As a women's health professional, you're seeing these issues show up now more than ever. Irregular cycles, hormone imbalances, or mysterious period issues. And deep down, you know you could support them better if you just had the right training. And this is why we've created our Fertility Awareness Mastery Mentorship Certification. In FAM, you'll learn how to interpret even the most complex menstrual cycle charts and confidently guide your clients through their hormonal and reproductive health challenges using evidence-based strategies. Registration is officially open for our next class starting in January 2026. And there's still time to register by our early bird deadline of November 14th. Head over to fertilityfriday.com/famlive to apply today. That's fertilityfriday.com/FAMMLIVE. This is the Fertility Friday podcast, episode number 602. Today's episode dives into an incredibly important topic that has not really been one that we've talked about on the podcast a whole lot. I think the only time this topic came up, the topic of painful sex, or pretty much the only time, was an episode quite a while ago, and it was related to one of the lesser known side effects of hormonal birth control, which can be painful sex. But in today's episode, we are talking about painful sex and vaginismus with Dr. Janelle Fredrick, also known as the Vagina Rehab Doctor. One of the main themes that came out in today's episode was how common an issue of painful sex is for couples. How many couples actually struggle with this? And not just that it's a little bit painful, but you can still do it, but actually the percentage of couples for whom the issue is so severe that sex may not even be able to take place. So this is a huge, huge issue. Obviously one that can be surrounded by shame and silence, something that people may be experiencing but not talking about. So I'm really thankful to have this conversation with Dr. Fredrick and to bring it out into the light, to normalize it so that couples who are experiencing this type of difficulty know that they're not alone, but also know that there's hope. And I think for me especially, the message that I hope shines through is that it's not normal for sex to be painful. And if it is, it shouldn't be that way. And there is support out there. And we should be seeking that. It shouldn't ever be expected that we should be, especially as women, it should never be expected that we're just supposed to continue to endure something that is painful. So before we jump into today's episode, I want to share a little bit more about Dr. Janelle. So Dr. Janelle Fredrick, known as the Vagina Rehab Doctor, is a world-renowned pelvic floor specialist dedicated to helping individuals overcome pelvic floor dysfunction and reclaim their confidence. Recently married, she proudly embraces her new name while continuing her mission to break the stigma surrounding pelvic health issues. Originally from a small city in Alabama, Dr. Janelle brings warmth, expertise, and a passion for empowering others. So without further ado, let's go ahead and dive into today's conversation with Dr. Janelle. I'm excited to be here today with Dr. Janelle Fredrick. Welcome to the show.
Thank you so much, Lisa. I'm very excited to be here. And I can't believe that I'm here. I used to listen to your podcast and I've heard about you for years. So thank you so much for having me.
Well, of course. I was really thrilled to have you because we're going to be talking about something that I haven't talked a lot about. I feel like if I think about all the different episodes, even over 11 years, I feel like this is not something that we've talked about a lot. It might have come up in passing. And so I know there's a lot of things we can talk about today, but I did want to ask you about pain with sex, painful sex. So I'm really excited to talk about that with you. But before we get into that, I'd love to hear a little bit about your background. So for those of us in the audience who aren't as familiar with your work, share a little bit about what you do and why you ended up focusing on this area in particular.
Sure. So I'm a pelvic floor physical therapist. I actually went to Oakwood University in Alabama. It's like Huntsville, Alabama. And that's actually where I just moved back to. So started off with my bachelor's there, went to California in like Northern California, a school called the University of the Pacific. And that's where I did an accelerated doctorate in physical therapy. So it was just 2 years, super quick and stressful. But once I finished, I started doing traveling physical therapy. And I remember vividly when my recruiter told me about a women's health physical therapy position. And this was going to be just about bladder dysfunction. So it was like urinary incontinence, frequent urination, urgency. So feeling like you won't make it to the bathroom. And I was only supposed to be there for 3 months for a contract. And I was so in love with what I was doing there that I just kept renewing it until I was there for a year. And so I was like, okay, this is something I need to look more into. And so that's when I decided to go ahead and specialize as a women's health physical therapist. Now, it's no longer called women's health physical therapy. It's called pelvic health physical therapy, just to be more inclusive. But I then went to Chicago, and that's where I did a residency at Loyola. I then started working at Northwestern, and that's when I got exposed to like more sexual dysfunction. So I started seeing that a lot of women were struggling with sexual pain in their relationships and intimacy. And I just really want to help women have pain-free sex. I feel that that's something everyone should experience, especially when there is a partner involved. I mean, that can drastically influence the relationship. So instead of trying to be the expert on everything, like pee in your pants, prolapse, pregnancy, I was like, let me just choose something. And so that's what I tend to focus on, just helping women to feel free and satisfied with their sex life.
Mm-hmm. Well, I mean, I've been following you for a while on Instagram. We were just talking about the grams, and I feel like the content that you're putting out is super fun, but it hits on such an important issue. So one of the questions I wanted to ask is just about prevalence. I mean, how common is this issue? Based on even just following you for a little while, I'm like, I feel like this is like a bigger thing that people aren't talking about.
Oh, it's very common, and it actually changes based on where you're located. So if you're in an Eastern culture, like there are certain parts of Turkey or certain parts of West Africa where the rates of sexual pain and vaginismus, which can actually make intercourse completely impossible. So 75% of women will at one point in their life have painful sex. So sometimes it's not because of the pelvic floor, though. It may be menopause or it may be recurrent yeast infections. But the fact remains that painful sex happens to 3 out of 4 women in their lifetime. Now, at one period of time, about 25% of women struggle with painful sex, which, I mean, that's millions and millions of people. So it's very common. And we do sort of niche down even a little bit more to vaginismus. And we see this happening a lot with women who have waited until marriage, women who are religious, women who try to do things the right way, and they seem to struggle the most. So we see it a lot. It's not talked about enough, but you just never know. There could be people that have babies and have not had sex. We also work with that. Like they've had a vaginal birth, they have never had intercourse. And so this is common, and you can't just look at someone and know whether or not they are struggling in that department or not. So we absolutely love to make this more known so that women can feel comfortable getting help, talking about this, and not feeling like so isolated or strange.
Well, you said a lot there. One thing I just want to touch on before I ask you more about vaginismus is that you said women who've had a baby vaginally birth even and have not had sex. And so are you referring to like the IVF scenario where they've...
No.
Okay, please explain.
So, I mean, I want to sort of take a few steps back. We work with various types of pelvic floor dysfunction. We still get the incontinence, occasionally prolapse, or someone preparing for pregnancy. They want to prepare their pelvic floor. But most, I would say 70% of the patients that we have, it's either I can have sex, but it hurts way too much, or I can't have sex at all because nothing can get inside. He's just hitting a brick wall. And so when that is happening for 5 years in your marriage, I mean, most people are ready to have kids by the 5-year mark. And if sex is impossible, you only have a few options. IVF, which many times they still go through the vagina. Like they still have to, what's it called? What's the little thing that they have to shoot stuff up there with? But they're using some sort of tool to get the sperm or whatever it is. Is it the sperm or the embryo? Child, you know better than I do, Lisa. This is fertility.
If they're doing the IUI, they're kind of inserting it in there if they're doing IVF. So yes, they definitely have to go in. the
Yeah.
vagina?
So a lot of our patients sometimes struggle with a finger, inserting a Q-tip, inserting a tampon. So there is something called the splash method, where if your partner just ejaculates around the vaginal opening, even if there's no penetration, the sperm can just swim up.
Yeah.
So
In the charting world, we call that like a contact pregnancy, where like it's kind of one of the teachings. Like if you want trying to avoid pregnancy, it's like, don't let him get it on his hands. And because if you touch it with your hand,
yes.
yeah, this is very interesting because I've never like heard this as a method of conception.
Yes.
So that
Oh,
is very
definitely.
interesting.
Or we have some people where maybe their partner can get in very impartially, like just the tip of the penis can get in. And somehow they get the sperm up there, but no full penetrative sex has taken place. And so we've even worked with women who are like, they got the 3-year-olds running around, but they're now experiencing pain-free sex for the first time after they go through like our coaching program, which is pretty detailed on how to actually release those pelvic floor muscles so that intimacy is no longer hurting. So you just cannot judge a book by its cover. What we see on TV is not real. It looks like everyone just has an easy sex life. You fall in love, you just go run into the room after dinner, you're throwing each other against the wall, and there's no foreplay. And you just go straight to humping each other. Like, it's just so fake. And people are really struggling with this, but I'm glad that the word is getting out there that there are solutions and you don't just have to like suffer through this problem.
Okay, so I want to ask, what is vaginismus and why is this happening? My brain is going to all these places, but I want you to tell me, and then I will ask some
Sure.
follow-ups.
I'm so curious, like, where's her brain going? Okay, so vaginismus is a pelvic floor disorder that can make penetration either completely impossible or very excruciating. And the reason why this is happening is because of 3 primary factors. One, there is significant pelvic floor tightness. Okay, so this is a medical grade level of tightness. We hear a lot that people think it's good to be tight. So we're not talking about that type of tightness where your partner goes, "Ooh, you're so tight." That's not medical grade level of tightness. We're talking about hypertonicity, which means your muscles are essentially held in a Kegel all day long. Like your muscles don't know how to let go of restriction. That is the level of tension that we're talking about, to where even a Q-tip may hurt or be painful. After the tension, the other thing is pain. There is true physical pain. It's not just in their head. It's not just, I'm afraid or we haven't done enough foreplay. There is pelvic pain that is preventing the insertion to be tolerated. And then also with vaginismus, there is usually, but not always, a fear component. And what we tend to see a lot of is women who are scared of pain. They've been told that it's going to hurt, there's going to be bleeding, they're going to rip their hymen. Just prepare to just grit through it and just hold on. I mean, so a lot of women come with either fear of pain or a history of sexual trauma that has also created some anxieties with sex. And so it's like a cocktail of things contributing to the impossible intercourse or the extremely painful intercourse. So that's vaginismus.
That just makes me so sad to hear.
And 1 in 4
right?
religious women have it. 1 in 4.
So, I mean, when I was saying like where my mind is going, I'm an interviewer, I've got questions, right? So part of it is that, and you kind of already said like it's beyond just not enough foreplay, but like, is this related to sometimes a lack of information about female anatomy and how it works, or even a lack of understanding of the sexual process? What is going on, right?
Okay, I love this. Yes, it is that. But also we see that anyone can have vaginismus. While we do see it more common in more conservative cultures, more religious women, we're also seeing it in women who didn't grow up going to church, and maybe their parents were pretty liberal and they're sex positive and they can't have sex. It also happens to women who have very high sex drives and they're erotic and all of this. So it's not one thing. But I would say a common thread that I'm seeing is a lot of avoidance, to where, okay, you wait until marriage and you try and have sex on your wedding night, but literally nothing has been tried before then. You haven't tried to insert a finger. You haven't gotten a pap smear. There's never been a tampon put in. So those muscles have essentially been unused for about 30 years or 25 years, whatever. So that's one of them. The other factor is poor sex education. to where some people don't know where their vagina is at all. Again, they think that this process of intercourse doesn't even make sense. How is that penis going to fit inside of my small vagina? Why is this not going to be painful? Oh, it has to be painful. So there's a lot of that. And then there's a lot of sort of religious silencing to where just in your upbringing, you just didn't talk about it. Sex is dirty. Sex is nasty. You can't do it until you're married. And then all of a sudden, when you're married, you're supposed to be able to just bust it wide open. So it's definitely a lot of factors involved, but sometimes there's no trauma in the background. There's no conservative religion. Some women, they don't know why they have it, or maybe they had an abortion. Some women develop it after very stressful life events. But the fact remains that those muscles just don't have the mobility required to allow comfortable intercourse. And then also sometimes there's fear and anxiety where we have to work with them on calming their nervous system too. And it's not just the physical. So it is an amalgamation of things. And I'm glad that there is solutions for it. But most people don't even talk about it because they're either shamed or misunderstood, or the doctor that they go to has no idea how to help either. And they're recommending wine or lubricant to fix these types of problems.
Registration is officially open for our next round of our Fertility Awareness Mastery Mentorship Certification. Whether you've been looking for a deeper way to support your fertility clients, whether you've been looking for an opportunity to teach fertility awareness in your practice, or whether you're just ready to interpret complex charts with confidence, you'll absolutely love what we've put together for you in FAM. But don't take my word for it. Here's what Gracie had to say about her experience in FAM.
When I decided to sign up, it was super last minute. I might have been like your last person or something. I didn't know if I should do it because I kind of had this weird imposter syndrome of like, is this for me? I remember I talked to a friend and she was just like, Grace, you care about this so much. Like, why would you not do it? It sounds like such an amazing opportunity. And it has been better than I anticipated. Every certification that I've done up until this point, and I've done many, and I just love how much in-person contact there is, how we like actually get to know each other, and that has been the most wonderful part about the program. Other things that I've done, it's very kind of screens off. If there is an in-person element, screens off, nobody talks. And I love that that's not the case here. Like, you can ask as many questions as you want. It's been probably the best part about this year for me, and I definitely did not have time for it. So if you think that's you, you'll figure it out.
Head over to fertilityfriday.com/FAMLive to apply today. That's fertilityfriday.com/FAMMLIVE. Right. And so something else that kind of came to mind, let me see if I can like word it. So working over the years with women of reproductive age, various ages, right? Like in the 20s into 40s and that kind of thing, even into 50s. Sometimes when I'm working with a younger population, right? Like the 20 somethings, and the caveat as well, as I mentioned to you, the sex is not the primary thing that I'm talking about with clients. It's usually about the menstrual cycle and charting. But obviously, if you're using the method for pregnancy or avoiding pregnancy, we need to be able to talk about when the sex is happening. And so naturally that lends itself sometimes into these types of conversations. And so I have seen many situations where you just kind of get into a conversation, ask about it, and then they kind of mention that sex is painful sometimes and that kind of thing. Mm-hmm. And sometimes it seems to be a situation where they're not saying anything. Like the sex is painful, but they're not saying anything. And it's like once you have a conversation and you talk a little bit about how the body works and you talk about how long it takes for the vagina to relax and lengthen and lubrication and like all that kind of stuff, then the lights start to go off and potentially conversations change. But, you know, it seems like a lot of women just think they're supposed to sit there and whatever happens, they're just supposed to like pretend to like it or something.
Exactly. So I see a lot that women don't feel like they have a voice, and that there's these expectations on us that we want to fulfill. Like we want to be able to say that our partner is pleased in the sexual department, or maybe they feel like they are being needy, if they're complaining that something hurts or they need to stop sex early. I think there was a study that showed 40 to 50% of women that deal with painful sex haven't even told their partners. And I remember a very clear situation. This is when I used to work in person at Northwestern in Chicago. There was a woman in her mid 40s. She came in for pelvic floor therapy for painful sex. And when I tell you, her vagina was so tense and tight, I could barely get my finger inside to do the assessment and release her pelvic floor muscles. Because she's been married for like 7 years. And she says she's been having sex the whole time. And I'm trying to figure out, how is sex even possible, number one? She goes on to say that she was having sex with her husband because she felt like it was her job, like she had to do that in order to be married. And we can judge her and sit here and say, oh, he sucks and you should have said something. But a lot of women feel that same way.
What you were saying about how your client, like you could barely insert a finger, but she felt like it was her duty to have sex. I mean, we have so much work to do. I don't know. And I feel like I'm jumping around a little bit, but I think that's what's going to happen with this conversation because of the nature of it. But what's the solution? Like, how do we change that? I mean, from my perspective and my views and values and all those things, like sex is something very special. It's kind of the most intimate you can be with someone in many ways. And, in the context of a loving relationship, for example, it can be such a beautiful thing. So it's sad to think of married couples going almost a decade without being able to fully enjoy it, like for both of them to fully enjoy this. And for one partner to feel like it's just a duty they have to do and not even to realize it's supposed to be enjoyable.
Oh, yeah. I think that there are so many layers to the work that needs to be done. On my side, me being a pelvic floor physical therapist, I'm really into the trenches of like the actual physical healing work, right? The nervous system and the pelvic floor muscles in women, knowing that those muscles even exist and that they can be causing someone's pain. But I think even further than like the physical and clinical work is the education that we get. What are we being taught about our bodies? And what are we being told as women? Is sex about pleasing your partner? If you're a wife, is it about just submitting and making sure that your husband is happy? Or is it a mutual experience where both people should feel safe and satisfied and not in pain? Because it's only taboo if we talk about it for women. If a man comes to you and says, I'm in excruciating pain during sex, you would think something is very wrong with him. But we don't think that way for a woman. We think that she should be bleeding. It should be painful her first several times. And that's the other thing. Women are confused. They're waiting for this first time sex to go away because we've been told that, oh, if you're a virgin, you're just supposed to be in a lot of pain because you're going to be really tight. So it's a lot of myths. There's a lot of antiquated stories that we're still holding on to. And we're not teaching women to be sort of the agency owners of their bodies. It's like, and even as a religious woman, okay, God is my creator. So he's the one that made my body, but also God wants me to understand my body. He wants me to be knowledgeable about sex. He doesn't want me to be in pain. He created pleasure. So I think like even speaking from all angles, whether we're speaking from a religious angle or a clinical angle, we need to empower women and couples to know that sex is a beautiful, pleasurable thing, not just done to please one person and not just done for reproduction. It's also done for just bonding and feeling close and connected to your partner. There's so much work. I mean, I think it's improving, but it's work to be done from several angles.
Well, so I have another question, and I feel like depending on the perspective of the listener, it could be controversial, but I'm not really that concerned. I'm not a big fan of like modern day porn. I just feel like it's a really big problem. So I know that not everybody would agree with that perspective, but I feel like it's like warfare material. Like I grew up in the 80s and 90s and like whatever they call porn today is like a whole other level. I think a lot of older people who don't know how far, and I don't watch it, I'm just aware of the categories, but like they don't know how far it's gone. Like it's just not even sex. Like what is happening, right? So the question obviously out of that is, because when you're talking about like this woman being married for 7 years, like I'm still on it. And you're saying that she was having sex with her husband on a regular basis. And like, is he not aware that she's super tense and uncomfortable? Because even if she's trying to pretend that she's okay, her body would be showing all kinds of signs of tenseness. And I mean, I could be demonizing him. He could have been the whole time like, are you okay? And years of her saying, I'm fine, I'm fine. Like, so it could have been like that too. But like, do you feel like that's playing a role at all? And is that changing the expectation of what this interaction is supposed to look like? Is that poisoning? In some cases, it could be helping because at least then you know where to put it. But like, you know.
So what I'm seeing is I'm seeing a lot of torn relationships where, okay, now there's a divorce or there's a breakup and it was just too distressing to deal with. The no sex, the painful sex, the whatever. But then I'm also seeing men that just are very patient, caring. They wait through it. They want to help their partner. They find creative ways to have pleasure because penetration is not the only way. But then I also see that women feel sort of on their own an obligation to please their partner. And so even if their partner is asking, are you okay? I think historically we have sort of been taught as women that we need to make sure our man is pleased or he's going to go out and get it from somewhere else. And so that narrative of hearing that, I think, I mean, even from like your aunties and people older, like, girl, make sure you take care of your husband, you know, or else he might step out. Just different things that is not helpful. Sometimes it's also just wanting to fit in. I also hear a lot of women say like they don't feel like their friends can relate to them when they talk about their sexual stories or their rendezvous with their husband, whatever. I think we want to feel whole, like we want to be normal. We want to be able to say we can have sex with our partner. And so there is pressure from society and the external, but there's also an internal pressure that you have an idea in your head of who you're supposed to be. And so I think there's a lot of just ignoring the body signals, especially when we don't know how to fix the problem. And we just sort of push through the pain in an effort to sort of keep the relationship strong or keep our partner happy.
Yeah, no, that makes a lot of sense. Well, so now I want to shift into like more of the solutions and the muscle, what's going on there. And so why don't you talk a little bit about how you address this? Like we've really hashed the problem, I think. We could hash the problem for 2 more days, but like we've hashed the problem quite a bit. And so where does someone start when they have these types of issues?
Whew, great question. One of the best places to start is just believing that they can heal, because we work with a lot of women that have had this problem chronically or either their whole life. Even if it wasn't sex, they've never been able to insert a tampon, or they've never been able to get a pap smear, or the pap smear was causing them to jump off the table. Someone like that who knows pain more than they know comfort and pleasure. It starts with just believing like your body doesn't have to stay this way. Because we can give you the best clinical treatment, but if your mind is still stuck in, I'm never going to get better, then it won't work. So that's where it starts. But then also, it also goes to relearning new narratives about your body. Yes, you may be experiencing pain now, but just like any other muscle in your body, those muscles can be retrained. The same way we can strengthen our butt muscles, we can strengthen our arms and get stronger. We can also get more flexible. We see people learning how to do the splits and they're like 35 years old, right? So it's so similar for the pelvic floor. These are muscles that are some of the strongest muscles in the body. Our babies come through the pelvic floor. They can be trained to release the tension and pain, but that is a process. So in that process, we are doing, as a pelvic floor physical therapist, I can say, we're looking at how much tension is being held inside, right? Because many times there is some internal work that needs to be done. The same way, if you have a tight shoulder, you may go to a massage therapist and they're like almost digging into the muscle to release that knot. The pelvic floor, the muscles inside of the vagina can be so restricted that a stretch or just breathing is not enough. And so we teach our patients, because we do everything remotely, how to use tools at home. Dilators, there's cylindrical tools that look like small penises. Like it starts from a really small thing that looks like maybe a finger. And we show them how to use these tools, how to use them to release pain, to release tension. There's also things like pelvic wands, which are tools that help more with sort of the angle, because the pelvis is not a straight line. Like your vagina is just not this straight line. There's a bowl. And let's say you're trying to have sex in a different position, you may need to release tension in a different angle of your pelvis. So we're teaching women how to use their own hands, how to use tools, and how to include other exercises and nervous system calming methods that help them to not be so afraid of their body, because a lot of this is also learned fear because it has always hurt. So that is typically the route we go, is we want to address your nervous system, but we also want to help you with the actual muscles, because if we don't open up those muscles, then sex will continue to be painful or difficult.
Well, and I have another question on those lines. I mean, how can the partner be involved in this? I'll just try to stream of thought this question. So if there's a lot of fear, whether it's, I don't know if there's shame or concern or discomfort, I would imagine that, first of all, if this is a issue about sex within the context of a relationship, I mean, it can't just be thought of as like her issue, her problem. It's like she can't have sex by herself. So anyways, I'm curious about the implications of like bringing in the partner, if that's a thing that happens, and like how that works. Or is there resistance to that? Is it more of like, I have to sort this out on my own?
Oh, so I find that it doesn't really go well when the woman feels that way. I have to sort this out on my own. I will say that culture plays a big role in how comfortable the man is with this healing process. I would say, in my experience, I want to say that my experience is limited, and not everyone in one culture will be the same. But in my experience, I've seen that African husbands, they're a little bit more closed off to like this process, where they sort of just want to go and have sex, and sex is the sacred thing. They don't want to use dilators. They don't want to see you struggling to get pain out of your vagina. And so sometimes I'm saying like, okay, if the man is not willing to help you use dilators, or if he doesn't want to go to the physical therapy session, we at least need him to just be supportive. Like, I believe you can heal. I believe we can get through this. We can get to the other side, because culture does play a big part on how people see things. And I'm just the pelvic floor therapist. I'm not going to change your husband's mindset on different things. We also do offer like couples coaching. So if someone actually wants to do each and every session with their partner, we actually will show their partner how to aid their partner in releasing the pain. We can show them hands-on tactics where they can physically release the problem for their partner so they can actually relax a little bit more. But generally, what we do, if it is the woman that we're helping in each session, we show her what to do in these hands-on sessions. So every session is hands-on. But towards the end of the program, we do 8 sessions typically. And if someone needs a little bit more sessions, they can book a couple more. But by visit 5, 6, 7, we start prescribing partnered homework. So that's when we're like, okay, we want you to do some foreplay first with your partner. Then we want them to use the dilator with you. And here are the strategies that we want your partner to use on you so that you can start relaxing, start feeling a little bit more unity sexually, and feel prepared to make the transition to actual sex. And so that's not required, but I do think it is helpful when the partner is willing to sort of, quote unquote, get their hands dirty. No pun intended, because it's intimate. I mean, even the healing is intimate. And so I appreciate when someone has a partner that is being as supportive as they can be. While it's not required to heal from pain, it's definitely a bonus when your partner believes in you and is willing to help out.
Well, and what are your thoughts on, like, I mean, there's a lot of information out there for anything you want to learn. Like, if you want to learn about sex, like, there's a lot of books. There's even courses. There's courses that you can buy. There's people that sell courses on, how to please your partner and all that kind of stuff. And what are your thoughts on some of those things? I mean, you know what I'm saying? Like the education around the way that the body works.
This is a great question. I will say, because again, we're seeing, I would say at least 50 to 65% of our clientele comes from a more religious background. Sometimes there is a little less knowledge or exposure to pleasure and sexual anatomy. I mean, I have people that are like, where's my clitoris? Where's my vagina? And is he putting it in the right hole? Right. So I get that occasionally, but I think a lot of the women and couples that we're working with are so focused on just being able to have penetrative sex that the pleasure piece is not so much of a concern initially. What we see is that after penetrative sex has happened, the woman is like, okay, well, his penis can get in. How do I make him feel good? So we're seeing that a lot sort of after penetrative sex is now pain-free and possible. But I encourage people to learn, like, make sure that whoever is the instructor, that their views sort of align. I did a pleasure course one time online, and it was interesting for me to say the least. It was about blowjobs, and I'm not judging on blowjobs. It's just the way that the course was taught. And I was just like, I think I'm gonna leave this to I'm gonna leave this to everyone else. So be comfortable and familiar with who the instructor is first, because if you're going to just be sort of weirded out the whole time, you're not going to be learning anything. And so you want to make sure that you're learning from someone who is sex positive and knowledgeable, but also does their style of teaching and their belief system sort of align with what your goals are as well. So that is my encouragement there. Learn as much as you can, though. Absolutely.
Popping into today's episode to let you know about our newest resource for women's health professionals, the Practitioner's Guide to Optimizing Egg Quality. This comprehensive guide breaks down the 5 key steps to improving egg quality, along with the top 5 evidence-based supplements to support egg development, mitochondrial health, and implantation potential. Head over to fertilityfriday.com/egg quality to grab your complimentary copy today. That's fertilityfriday.com/egg quality. Now let's go ahead and jump back into today's episode. Well, and one question that, surprisingly, that we haven't even touched on it a whole lot, I think you mentioned it a little bit, is, for women who are dealing with these issues, because you did mention it was like, oh, just drink some wine or just relax or whatever. Just based on everything you've experienced, what suggestions do you have? How does one find support, and how does one not feel discouraged if you have been dealing with this and you've actually tried to seek support and maybe not received the support that you need?
Yeah. I would say a big one is to have both social support and expert support. So everyone who has a white coat isn't an expert in painful sex or vaginismus. And so when you go to your doctor and they start recommending things that you could be recommended from a group chat, so have a glass of wine, relax, or use more lube, that's not really skilled advice. I mean, you don't have to get a degree to go tell someone that, right? So I would say once you realize that that's the most advice that you're getting from your doctor, you want to look and do some research to figure out, can you work with a pelvic floor therapist that actually focuses in on vaginismus or sexual pain? Because that's the number one proven expert to treat sexual pain. First and foremost, it is a pelvic floor physical therapist, and it's the most non-invasive route. There's no surgery involved in that. So that's the number one. Try, if you can, to work with a pelvic floor therapist who studies sexual pain. And then the other side is, you don't want to just do the clinical. Is there a support group? Is there a friend or a girlfriend you can talk to that is not going to shame you or act like you're just this weirdo or say, oh, I've never had that problem, I don't know what's going on with you? Someone who can provide support emotionally more than just your partner. I think we do put a lot of pressure on the partner. Like, we want our partner to be our everything. But especially as a woman, I think we thrive on relationships and community. And so find someone who you can open up to and someone who can help you be consistent with what you're doing. Even if you can't afford pelvic floor therapy or you can't get to a doctor, doing some pelvic floor stretches and pelvic floor relaxation exercises can drastically help and reduce pain. So there's something that everyone can do regardless of your economic level or capacity. Just do something. If you truly want to see this change, then, we have to put forth the effort to allow our bodies to heal.
Well, and one other question along these lines that I thought of is the hope piece. So for women who have identified this issue, they're willing to jump in and figure it out. They're learning, they've got their dilators, their partner's on board, he's super supportive, right? It's working out. So typically, like, how long do you see it take before, these women start to feel that relief and actually start to be able to enjoy sex with their partners again?
So this is where I get extremely geeked out and happy because when I used to work in person, it would take me maybe 6 to 8 months to help women overcome this. Currently, our average amount of time is 8 to 10 sessions, which equals out to just about 2 to 3 months. And we always say 2 to 3 months because we're women. I mean, we have periods. Maybe we get sick. Maybe we travel. So I don't like to say only 8 weeks. And then if something comes up, it's longer and someone's disappointed. But we really only need that length of time. If someone's coming every single week to their sessions, they're doing the homework, they're not just going home and like, I don't want to do anything. Then it doesn't take that long because your body is created for this. We're not teaching you how to fly. We're teaching you how to do something that your body was made to do. And so generally 2 to 3 months of time is how long it takes with us. But that's with the caveat of we are studying this problem a little bit more than the general pelvic floor therapist. So in person, if someone went in person, I would say the average time is about 6 to 8 months. And that's sometimes good. So don't give up, even if it's taking you longer. It doesn't mean that you can't get better. It just may mean that you need a new approach or you need a different style of therapy that can actually work for you.
Well, so that's really interesting. That's a big difference. That's double or triple the time. So I know you mentioned that you've shifted your practice obviously online and you run programs online. What is making such a big difference in terms of the speed to sex, dare I say?
Yeah, I would say I think it's three major things. One is what we've already discussed. I've been studying vaginismus for a while. I mean, there are people who believe that this problem of impossible intercourse is because of this random spasm. There's this muscle spasm and it's just stopping your partner from getting in. But that is from a research study from like umpteen years ago. It's so old, it's disproven that they have now even changed the name. So technically vaginismus is considered the old name, and it's now lumped into a condition called genital pelvic pain penetration disorder. And so that is because vaginismus means spasm of the vagina. So that's now been debunked. And so I think number one is we just understand the condition a little bit better. Number two, we're showing women how to take ownership over their healing by teaching them hands-on tools they can do at home. Instead of when you go into a clinic and you do pelvic floor therapy in person, typically you're going to lay on a table and the provider is just going to do all these things to you while you essentially just lay there. You could completely disconnect and be on your phone. And so you're not really learning, well, how do I manage fear of my own body? How do I use these tools to release my own pelvic floor? So we're seeing more ownership. There's way more accountability. There's no option of you didn't do your homework because we're not touching you at all. So you either have to do the homework and see the results or you're not going to get the results. And then lastly, we're able to include more non-clinical things. Like we talk about pleasure, we talk about sex positivity, we talk about understanding your pain and what pain science is. And so I think women are feeling more coached and guided with our program instead of just like, okay, go home, do these exercises, and that's the end of it. It's very hands-on, it's very actionable, and women are able to learn how to feel like the CEO of their body. And so to me, that's what's making the difference. But I have to say that physical therapy is still helpful for a lot of people and it's still beneficial. It's just for this specific problem, we're seeing that the virtual route tends to work a little quicker or a lot quicker.
You know, that makes a lot of sense. It makes a lot of sense that if you kind of figure out how to kind of ease into this in your own home and then eventually you involve your partner. I mean, you're gearing toward intimacy and it's not intimate. I don't know how to say it, but like if you're sitting at a table with like kind of like a sort of stranger, I mean, You can get to know your physical therapist quite well, but I mean, they have their fingers in your vagina. It's just not the same level.
It's a white room.
Yeah.
It's bright. Yeah, exactly. You're at home in your comfortable space. And then you have women that have been through a lot of trauma and sometimes the home and like just feeling like no one else has to navigate their private parts can be sort of comforting as well.
Yeah. Oh my goodness. I feel like you've really enlightened us today.
Thank you, Lisa. I appreciate you. And the last thing, what were you going to say, Lisa? I'm sorry.
You're probably already on top of it because the last thing I was going to ask is if there's anything that we didn't talk about and that if there was anything you wanted to share for women who might have tuned in specifically because they saw the title.
No, I just wanted to say that, like, don't forget about your pelvic floor as you pursue pregnancy and as you think about your fertility, because generally fertility planning and trying to grow your family does involve sex. And it's after pregnancy too. Your pleasure matters before you get pregnant, during, and even after. As you become a mom, you're going to eventually want to return to sex, right? So don't forget about that piece. We've seen so many women get pregnant soon after finishing treatment because now they can actually get through the act. And so remember that your comfort matters. It's not just for your partner, it's for you, and that there is healing available. Like, there is hope and you can do this.
That is amazing. It's still, like I said, when you first kind of laid it out, it just made me sad because this is a really big issue. And I mean, it has the potential, obviously, to tear apart relationship, infidelity to enter, and just lots of confusion. That there's a solution, though. It doesn't have to be this way. Right.
Yes.
So happy that you're out there. You're healing the world one vagina at a time. Do anything.
Oh my gosh, Lisa, thank you so much.
So why don't you share with us where people can go to learn about you, your Instagram, TikTok, all the things, and talk about your program, share all the things.
Sure. So if you want to learn more about me and just what I do, get more comfortable and connected with me, I am the most active on Instagram, also on TikTok with the same handle, Vagina Rehab Doctor. Everything is spelled out. There's no abbreviations, Vagina Rehab Doctor. And then if you are interested in one-on-one coaching with us, you can set up a free consultation at vaginarehabdoctor.com. And again, everything is spelled out.
Amazing. Well, we will make sure to link all of those places in the show notes. Thank you again for being with us today and enlightening us on vaginismus, which is now we know that is even the old title, because I do remember learning it's the spasms. Everything you said made so much sense. So thank you for enlightening us and for giving a hope, especially for couples that have been struggling with this.
Yeah. Thanks for having me, Lisa.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page over at fertilityfriday.com/602. I hope that you enjoyed today's episode with Dr. Fredrick as much as I did. I mean, wow. I have heard of a lot of issues in my time, but I'm still going to need a minute to kind of digest what she said about the splash method. I mean, that is something that, as you were listening, you probably heard me like, what? Say that again. What did you say? What did you mean when you said that? Don't even think that if a person has had a baby, even a vaginal delivery, that they have actually had sex before, because there are couples for whom sex is such a significant issue, challenge, problem, causes such significant pain that there's an actual, quote, method of conception that doesn't involve penetration, so that couples can still conceive even if they're not able to have penetrative sex. I mean, that was something that was certainly new to me. So I really appreciate this conversation today, because there are various aspects of this conversation that I have heard before when it comes to education around sex and intimacy. And it's really tragic when you hear stories of couples who are married, newly married, or have been married for a fairly significant period of time, but they lack education around sex, sexual activity, to the point that it's interfering with their ability to actually have intercourse, right? So this is important for women to know, for couples to know. Education is so important, but it's also important for practitioners to be aware of this. And this is one of the themes that often comes up in FAM, which is, I always say, you can't assume anything. When you're working with a couple, you never want to just assume things. You don't want to assume that, for example, if they say, oh yeah, I use condoms, like, you don't want to assume that that means that they know how to use them correctly. Like, you want to just investigate that a little bit more. And even a reminder that if you're working with for couples that have fertility challenges, you don't want to assume anything. Sometimes you have to actually get down to the nitty gritty. Is sex happening, and when is it happening, and things like that, and how is it happening? And because there's an actual real issue of a small percentage of couples who are really not having penetrative sex for one reason or another. And so I think the bottom line, biggest takeaway that I had from today's episode is that, of course, there's hope And it's really important not to kind of suffer in silence. If you're having certain challenges, it's really important to seek out support. And it's so comforting to know that there is help out there. And what I always say for specific issues, you will have in any area best results when you're working with someone who truly specializes in that issue, where this is what they do all day long. This is their clientele, because those are the situations where you're really going to be helped when your provider really knows. So I'm glad that Dr. Janelle is out there supporting couples, and she's really fun to follow on Instagram because she really just kind of puts this issue out there in the open and addresses it, I think, with humor and with grace and with the intention to really destigmatize these topics and to normalize it to some degree, so that if you or someone that you know has experienced something like this, that you know that you're not alone. She gave some pretty heavy stats. This is more common than we would think, and so important to be breaking those barriers and bringing this knowledge to women and couples. So with that said, I hope you have a wonderful weekend whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting. And that's a wrap. If you've been loving the podcast and you've been thinking about ways to incorporate fertility awareness into your women's health practice, then I know you'll love our Fertility Awareness Mastery Mentorship Certification Program. It's a 9-month immersive experience that will completely transform the way that you work with clients. And registration is officially open. Head over to fertilityfriday.com/famlive to apply today. And in the meantime, have a listen to what our practitioners have to share about their experience in the program.
So much of it is bringing in your charts and clients' charts and seeing real life charts, because they don't look like what the textbooks tell you. So what this has really given me is the confidence to then go and teach people this method for whatever their desired use is, and then be able to tailor the treatment to exactly where they are in their cycle, rather than kind of being like, do you think you've ovulated? Like, oh, I don't know. Like, So like it's made it really specific. I just have this like wealth of knowledge now, and this ability to teach people like exactly where they are in their cycle, and for them to understand exactly what's going on. And there's no assuming anymore. Like I just assumed I ovulated on day 14 because that's where everything told me. And actually that first chart, what was day 20 or something? Like just because I had a 28-day cycle, it was far from what I thought it was. And like I've got the data now to back that up. And I've done courses before where I'm like, they're just doing written work so they can tick off part of the certification, where it's like everything followed on from the next thing, and you just feel so equipped and so supported to then go forward with your clients. And it's been the best thing I've done this year, 100%, because it's just given me so much confidence.
Transform your practice in 9 months. Head over to fertilityfriday.com/famlive to apply today. That's fertilityfriday.com/FAMMLIVE.